on Louisiana's home team. This is Fox 8 News at 6 a.m.
It's called Peripheral Arterial Disease, also known as P.A.D, and it can be deadly. And here to share more info on this deadly disease is Dr. Craig Walker, the founder and the president and medical director of the Cardiovascular Institute of the South. Good morning. How are you?
Just fine.
So tell me exactly, what is this?
Peripheral arterial disease represents blockages within arteries outside the arteries of the heart. So if we have these blockages within the heart, we call that coronary disease. But if they're to the brain, this is carotid disease, or to the kidneys, renal artery disease, or to the legs. These are all lumped together to be called peripheral arterial disease, and it's huge. It affects 20 million Americans, and it's a marker of death. If you have a diminished pulse in your foot, you're much more likely to die of cardiovascular diseases, even if you have no symptoms. It's easily detected and something that can make a big difference in health care.
So for those who may or may not have it, what would the symptoms be?
Well, it's a great point. The classical symptoms of peripheral arterial disease in the early time frame is that one develops cramping, pain within the muscles, typically of the calf, as they walk, or they have severe high blood pressure with kidney artery disease. However, it is important to realize that the overwhelming majority of people with peripheral arterial disease have no symptoms at all.
So what do you suggest?
Yeah. Well, it's a real simple thing. Obviously, very advanced disease, you see gangrenous changes. That's easier. Ulcers or wounds that won't heal. But in the earliest stages, before symptoms really are obvious, just simple exam of the foot pulses makes a big difference. One would not wait to evaluate for cervical cancer or breast cancer until you have big symptoms. You have to look for it. That's how you prevent it. That's how you get to it early. That's how you stop the mortality. Same is true here. In the simplest of all things, something which costs nothing, just a physician assessment of the pulses in your feet, can detect this in the overwhelming majority of people.
So what do you see in our area with this? Who's most at risk? Is it a predominant problem?
It is a huge problem. First off, when we talk of numbers in excess of 20 million Americans, it represents a huge swath of people. But who's at greatest risk?
That you see locally especially.
A lot. Of course, and the incidence is higher in the South. Now, the biggest risk factors for peripheral arterial disease are the following: advanced age, and our population is growing. In fact, the most rapidly growing segment of our population are octogenarians, people older than 80. Secondly, diabetes. There's an absolute epidemic of diabetes going on right now. Many epidemiologists believe that in as short a time as the year 2020, that up to 50% of Americans may be at least glucose intolerant, and cigarette smoking. Now, other risk factors are high blood pressure, high cholesterol, but they're a much lesser risk factor than those first risk factors. Certain races are more prone to amputation: blacks, Hispanics. And so these sorts of things are things we have to always think about if we're going to stop this epidemic of amputation and needless deaths that could have been avoided by simply detecting this disease.
So clearly it's deadly, or it can lead to you losing your limbs. So what age should you start asking for the test, and what test should you ask for finally?
It's a great point. To start with, a physical exam. Just your shoes should come off in a doctor's office, pulses should be checked. But who should look into this a little bit more? Well, certainly if you have symptoms, the leg cramping or these things, it's important. If you have a family history of this problem, if you're a diabetic. And there was a trial done in the past called the P.A.D trial. It was done throughout the United States, in which they did screening pressure measurements in the legs of anyone over age 70 with no risk factors, or anyone over the age of 50 who was either diabetic or had ever smoked. And within that group, 29% of them, 29% had evidence of peripheral arterial disease. This is a hugely positive number. That's a much bigger number than the number of people found to have an abnormal mammogram or an abnormal pap smear. These sorts of screenings ultimately should become mandatory.
And they're life-saving. Thank you so much, doctor, for coming in and pointing that out to us. And hopefully more people will ask their doctors